Meth addiction can impact every aspect of your life. For many people, meth use began as a way to enjoy themselves at parties, stay awake, and maintain energy. Unfortunately, methamphetamine use is dangerous and carries risks for physical and psychiatric health. If you or someone you care about has experienced a meth-related psychotic episode, you may have some important questions about it. Like, what is meth psychosis and why does it happen? Psychosis is a complex mental condition that profoundly affects a person's perception of reality. It manifests as a distortion that blurs the line between what is real and what is not. Individuals experiencing psychosis may encounter hallucinations, where they perceive things that are not actually present, or they may hold beliefs and ideas that lack logical coherence. Additionally, they may also experience paranoid feelings, constantly feeling threatened or suspicious of others. Methamphetamine, commonly known as meth, is a powerful drug that exerts its effects on the central nervous system. Its impact extends beyond its immediate psychoactive properties. Why? Because it can lead to significant impairments in the functioning of the brain, nerves, and senses. When these vital areas of the body are disrupted due to meth use, individuals may exhibit severe physical symptoms such as rapid weight loss, dental problems, and skin sores. Furthermore, the psychiatric effects of meth can include anxiety, depression, and even psychosis, exacerbating the already distressing consequences of its use. It is important to understand the complexity of these conditions and the potential harm they cause. By raising awareness and promoting education, we can work towards prevention, early intervention, and effective treatment strategies to support those affected by these challenges. Another question that may be posed is, does meth psychosis only happen to people who are already living with a mental health condition? Methamphetamine use, a potent stimulant, has been linked to the potential onset or worsening of psychiatric symptoms in individuals already grappling with mental health conditions. However, it is noteworthy that even individuals without a prior history of mental health conditions may also encounter psychiatric symptoms, including the possibility of experiencing psychotic episodes. These effects underscore the complex interplay between substance abuse and mental well-being. In addition, it highlights the need for comprehensive understanding and support in addressing these challenges. So maybe by now you're wondering, what are the symptoms of meth psychosis? Meth psychosis has similar characteristics to psychotic symptoms caused by mental health concerns. Some of the most common symptoms of meth psychosis are visual hallucinations, or seeing things that aren't there, auditory hallucinations, or hearing things, tactile hallucinations, such as a feeling of something crawling on the skin, paranoid ideas, or thinking that people are out to get you, strange ideas about other people or the world, unreasonable, unpredictable behavior, violent or angry outbursts. If you've noticed any of these symptoms in a loved one, it is important to get help as soon as possible. Meth psychosis can be treated, but the sooner you seek help, the more successful the treatment program can be. So now you may be thinking, well, how long does meth psychosis last, and how can it be prevented? Well, here's the thing. Sometimes meth psychosis only lasts for a period of hours, wearing off as the meth itself loses its effectiveness. However, over longer periods of time, meth can lead to periods of psychosis that can last for days, weeks, or even longer. Especially if a person is already living with a mental health condition, meth use can present a powerful danger of extended psychiatric illness The best way to prevent experiencing periods of meth psychosis is to stop using meth. In addition to the many other health risks that meth use carries, reducing the risk of psychiatric illness is a very good reason to think about seeking treatment for meth addiction. So you've been given all this information about meth psychosis, and by now you may be thinking, can a meth addiction program actually help? The answer is yes. If you or a loved one has been using meth, it's time to reach out for help. Unfortunately, people who use meth tend to have problems at work or at school, in their family and personal relationships, and even with law enforcement. Seeking treatment for substance use and addiction can help you or your loved one get back to living a healthy, happy life. Harm reduction. Harm reduction is an evidence-based approach that is critical to engaging with people who use drugs and equipping them with life-saving tools and information to create positive change in their lives and potentially save their lives. Harm reduction is a key pillar in the U.S. Department of Health and Human Services overdose prevention strategy. Crystal meth and harm reduction. So what is crystal meth? Crystal meth is a pure, more potent form of methamphetamine that can be snorted, smoked, or injected. It's a stimulant drug that increases dopamine and serotonin levels, the feel-good chemicals in the brain. Crystal meth increases alertness, sex drive, energy, and pleasure. It also reduces appetite and can cause extreme weight loss. Crystal meth is highly addictive and can have negative side effects, including anxiety, paranoia, aggression, psychosis, and hallucinations. Long-term use can lead to brain, liver, and kidney damage, dental problems, and mental health issues. When smoked or injected, the effects of crystal meth are immediate and can last up to 12 hours. It can take a day or two for the effects to wear off. The high is intense, and people can experience paranoia and anxiety. Harm reduction. All drugs carry risks of harm. If you use crystal meth, here are some suggestions for reducing the risk. And this is a guide only. So first, start with a low dose, then wait an hour before having more. Choose a safer method of use. So try smoking or snorting meth instead of injecting. Boil your smoking device in water to keep it clean. Then there's avoiding sharing needles and equipment. Doing so to reduce the risk of transmitted viruses such as HIV, AIDS, hepatitis B and C. Also, depending on where you're located, clean syringes, safe disposal containers, and sterile equipment are available at needle and syringe sites. So another way to reduce harm is to avoid mixing with alcohol and other drugs, as that can increase your risk of overdose and other health issues. If you plan on mixing, use a mixing calculator to find out which drugs are lower risks for mixing. Next, there's practicing safe sex while you're high. Use condoms and use other safe sex equipment like lubricant and have regular sexual health checks. Try talking with your sexual partner about how much meth you use and communicate your limits and what you plan to do. You could also use with people you know and trust to help you if something goes wrong. Also, take breaks or even plan time to sleep and rest. Make sure you drink water to prevent dehydration. And try to plan a healthy meal every day. You should also know how long it lasts so you know when it's safe for you to drive and operate machinery. It's also best to use a drug calculator for that time so you'll know the drug duration. A tip that I'm sure your dentist would love is to practice good dental hygiene, meaning regularly brush your teeth, floss your teeth, stay hydrated with water rather than sugary drinks, and visit the dentist regularly to help reduce the effects that meth has on your teeth. Last, but certainly not least, avoid frequent and regular use.